Hi, my name is Jody Wisthazen. I'm a BSN student with Indiana State University School of Nursing. For my community health education project, I've chosen to focus on the population at risk, which includes ethnic minorities who also happen to be economically disadvantaged. And so for my project, I'm focusing on hypertension. This population is often undereducated and does not receive adequate medical care, and hypertension is a prominent yet controllable medical condition that is often found in this population. So this presentation will focus on providing educational material to patients recently diagnosed with hypertension. You've got high blood pressure. Now what? High blood pressure is also known as hypertension, and in this presentation we will go over what causes high blood pressure and how we can help control it. At the conclusion of this presentation, the learner will be able to define high blood pressure, determine what lifestyle behaviors may contribute to elevated blood pressure, identify actions to take to manage blood pressure, identify consequences of uncontrolled blood pressure, and develop a plan to keep blood pressure within the target range. Please take a moment at this time to complete the pretest. You can pause the video and click the link below. So what is blood pressure? What exactly does it tell you? Blood pressure is a measurement which is reported as two numbers, systolic over diastolic. The top number, known as systolic blood pressure, is the amount of pressure in your arteries when the heart muscle contracts, or how much force is needed to pump blood to the rest of the body. The bottom number, known as diastolic blood pressure, tells you the amount of pressure in your arteries between beats when the heart is resting. The systolic number is higher than the diastolic number because greater pressure is needed during the work phase than during the rest phase. Blood pressure of 115 over 74 is an example of what a normal blood pressure would look like. Blood pressure readings fall into one of 5 categories. Normal blood pressure is what we would consider the desirable range. This is where we want our blood pressure to fall. So here the systolic would be less than 120 and the diastolic would be less than 80. So our previous blood pressure of 115 over 74 falls into this category. Elevated blood pressure is higher than preferred, but does not always require a medical intervention, especially if you're willing to make the lifestyle changes that we'll be discussing in this presentation. So with elevated blood pressure, a systolic would be between 120 and 129, while the diastolic continues to be less than 80. 124 over 78 is an example of an elevated blood pressure. Hypertension level 1 has a systolic range of 130 to 139 or a diastolic range of 80 to 89. While both of these numbers don't have to be elevated, you can have a high systolic and a normal diastolic, or vice versa. Very often they are both elevated, such as 136 over 84. Hypertension level 2 has a systolic of 140 or above, or a diastolic of 90 or above. Again, they don't both have to be high to fall into this category, but more often than not, they both will, such as 142 over 94. Finally, the last category is hypertensive crisis. This is when your systolic is above 180 and or your diastolic is greater than 120. This is an emergency and requires urgent medical care. What causes high blood pressure? There are many factors that contribute to elevated blood pressure, some of which we can control. Smoking or the use of any product containing nicotine increases blood pressure. Drinking too much alcohol can also raise blood pressure, as does a sedentary lifestyle or sitting too much, being overweight, eating unhealthy foods such as processed sugar, fried foods, and excessive salt. High cholesterol and diabetes also contribute to high blood pressure. So what changes can you make to control your blood pressure? You can stop smoking. Give up or moderate the amount of alcohol you drink. Get up and exercise. If you have a desk job, stand up and take a short walk around the office every 1 to 2 hours. Change your eating habits. There are many ways to incorporate healthy foods into your diet. ChooseMyPlate.gov is an excellent resource to help you get started. Cut back on your sodium intake. Read food labels. Processed and prepared foods often have added salt and preservatives. All of these changes also help reduce cholesterol and blood sugar. Lowering these risk factors also help lower your blood pressure. What if you don't want to make these changes? What happens if you do nothing to control your blood pressure? Well, according to the American Heart Association, uncontrolled blood pressure can lead to other serious problems. High blood pressure puts excess pressure on the blood vessels in the brain. This can cause vessels to burst or become clogged. Either of these can result in stroke. Chronically elevated blood pressure strains the vessels in the eyes, which can cause loss of vision. Excess pressure can cause the heart to enlarge, which decreases how well it can pump blood to the rest of the body. This is called heart failure. Heart failure is different from a heart attack, which is when arteries in the heart become blocked and can no longer pump blood to that area of the heart, so it can no longer function. High blood pressure damages the kidneys. When the kidneys become damaged, they can no longer effectively filter the blood. Finally, sexual dysfunction presents as erectile dysfunction in men or low libido in women, and this is due to inadequate blood flow to the genitals. So after all of this, what have we learned? Let's make a plan. First, we want to make a plan to stop smoking. You can discuss options with your doctor, join a support group, or find resources online. Limit the amount of alcohol you're consuming. Women should have no more than 1 serving of alcohol per day, and men should have no more than 2 servings. Get out and exercise. Take a brisk walk 30 minutes a day, 5 days a week, or aerobic exercise 90 minutes a day, 3 days a week. Just get up and move. Let's start eating healthy. Try to eat a variety of colorful fruits and vegetables every day. Baked, grilled, or steamed food is healthier than fried food. Eat lean proteins such as fish, chicken, eggs, nuts, and low-fat dairy. Do not have more than 1,500 milligrams of sodium or salt in one day. Limit your sweets and refined sugars. Read food labels and make wise choices. Take any prescribed medications every day. Do not stop taking your blood pressure if your blood pressure becomes normal. This means your medication is doing its job. If you've made these lifestyle changes and you notice your blood pressure is consistently low, talk to your healthcare provider and follow their advice. It's full of valuable resources. Here are some links to get you started. Don't forget to take your post test to see how much you've learned. Please click below to find your post test. Thanks for your participation in this presentation. I hope it's given you some valuable information that will help you live your best life.